So I want to say thanks to everyone for joining us live for our updated Mathematic Virtual Town Hall. We're excited to have you here again, and so thrilled that you chosen to spend your lunch hour with us. Shout out to Tim Anderson for the George Clooney profile pic. Pretty awesome. So thank you for adding some some humor into this. But again, thanks everyone for joining us. We have a really fantastic program today, and I don't want to wait too long before kicking it off. Just a few housekeeping reminders. If you are not speaking, put yourself on mute so we don't have a lot of background noise. And if you have questions, please, we absolutely encourage them. Pop them into the chat bot, or you can use the raise your hand option. But again, yes, thanks everyone for joining us. And I'd like to turn it over to Joe Mullings, who's going to be our first speaker for the day. Joe is an incredible asset to our organization and a great friend of Mathematic. I know a lot of you know about him and the work that he's done, and he's just great person to have in our community. So Joe, take it away.
Thanks, Rachel, and thanks, Brian, especially. And again, big shout out to Mathematic for carrying the torch across the world, not just Massachusetts in general. So I think it should never be lost on the audience that you've got here and across the world. So thanks for that. My contribution today is about the workforce, and some of you have been affected one way or another. And the other side, too, I want to address is those that are looking to build the organization. I want to share with you what I think is going to be happening based upon a lot of the conversations I've had in the recent past, as well as past analog models around this. So I'm going to jump into it and try and leave as much time for Q&A as possible. So the COVID-19 situation, basically what it's done is it's accelerated eventual outcomes in a number of theaters. It showed us what has been compromised, what is straight up weak, and what is strong and will probably carry through the other side. And about the world of work in general is what I'm going to focus on today. Two areas. The interim career opportunities for companies as well as personal careers, and the strategy that I would strongly recommend, and I've been sharing with everybody, what I call the 10-4-2 strategy for networking. Let's start out with LinkedIn. LinkedIn is the platform that you should be doing your talent access on. And when I use the word talent access, that talent access is access to talent in the marketplace if you're a hiring manager or a company looking to hire, and that's still happening quite a bit. And then talent access from the talent in the field. How should you be looking for new opportunities today, or maybe you're not aggressively looking, but you are looking in the near future? And with LinkedIn being 660 million people and growing online, and a very large cohort in the medtech industry, that should be where you should be looking. Now, social and the use of social. Invariably, I have a couple different categories within the social field and the adoption utilization of it. Don't mistake social for duck lips and kitty cat videos that either your teenage niece or nephew ruined because of those duck lip pictures, or grandma was posting kitty cat videos on Facebook. Therefore, you've disregarded the use of those platforms at scale, that it's really silly social. It's not. It's a fantastic tool if used appropriately, especially as you build your team and your organization. The workforce makeup is changing very quickly, even before the C-19 crisis. Before the current rate of employment or unemployment right now, we had 160 million people employed in the U.S. Of those, 65% were full-time employees or perm employees. 35% were interim or contract. You'll hear me use the word interim in collaboration with contract. But that's been the workforce makeup over the last few years, especially before we went into COVID. Interesting dynamic, though. The average full-time tenure has been 4 years and falling, okay, so declining. Largest contingency, but has been dropping off from 4 years, indexing towards 3 years. The average contractor interim has been 2 years and climbing. So as you look at those, you need to realize that, sure, the bigger pool is perm, but the smaller pool, which is a third of the workforce, has been climbing, and it's becoming more usable, more acceptable. So it's a worldwide trend as well, not just in the US. So two markets, the same world of work, but the trajectories are in a different direction. And I'm setting this up right now and explaining to you why I think it's important that you look at it this way. When we look at contract and you're building a company, or you are looking for your next role and maybe you are furloughed or laid off, you've got to understand that the dynamics and the rate of technology and acceleration of technology in the workforce is changing so rapidly, it's hard for these organizations to keep up the speed. So they're going to be having to hire individuals who are able to immediately come in day one, no grass growing under their feet, and be able to solve some very specific problems. And that's very sort of commonplace in the medtech industry. Most of you have very specialized skills. And I'm giving you guidance that if you were furloughed or laid off or are even looking, we're going to want to look at the interim business at the same time we're looking at the perm business. In the past, people have said the gig economy. Isn't that the gig economy? It is not the gig economy. The gig economy was a personal choice of individuals at that point in time. The current unemployment rate and the rate that we're running at and continue to accelerate is now really where the interim model falls, meaning that gig was a choice for personal lifestyle, places in the country you wanted to live, even industry specific. The interim model now is going to be driven by less jobs in the marketplace, therefore more people fighting for those jobs. And you, if you were stuck in a furlough or a layoff, did not choose to be where you are. But I'm letting you know that more and more organizations are tactically and strategically looking at hiring interim employees because it declares itself on the balance sheet from a financial perspective differently. And it also allows them a level of flexibility in being able to throttle up and throttle down that workforce or that employment on demand. And I will let you know that 50% of the time, they're converting those to full-time employees. There's one of the areas I want you to think about, because getting back on the field in a contract or interim role will serve you well to be able to convert it over to a full-time role. Here's the biggest issue. You go to a cocktail party, and a majority of people don't want to let people know they're embarrassed or they feel like it's clumsy or it's less professional that they're contracting or consulting or an interim role. You need to get over it. It really is the world of work. And I think over the next 3 to 4 years, especially in my seat, especially in the medtech industry, you're going to see a larger percentage of strategic and tactical moves by startups especially, and the large players and the mid-caps in between are going to become a lot more educated and a lot more tactical with how they're going to flush out their workforce. So don't be hung up on waiting to get back into the workforce in a full-time role if you've been bounced out for whatever reason. It's a very simple explanation, C-19 situation, everybody's going to know it. But those that embrace the interim pathway back to employment are going to find themselves with more opportunities downrange 3 to 6 months from now. It's just the world of work that we're in. So historically, HR has been, and I mean this respectfully, HR has been the place that hiring, identification of talent, putting out the hiring narrative for an organization, taking in the individuals who apply for opportunities, has been where corporate leadership, large and small, has tossed that function. Totally under-resourced, overworked, and ill-equipped with the tools. Any headhunter in the world who's a top 5 or 10%er is going to tell you HR dislikes doing search, dislikes hiring, and is more probably attuned, trained, and enjoys the internal employee development more than they do the acquisition of talent, the attraction of talent, and the landing of talent. And I think for the workforce we're in today, as the workforce gets settled and rebuilt, the smart leadership, executive leadership, is going to start to divide HR from talent acquisition and talent access, meaning you're going to have strategic leadership now held in such a high regard as they do the VPs of Reg, Clin, Qual, operations, manufacturing, R&D, and how the specialization in each of those verticals, you're going to see that start to declare itself. HR will remain that super valuable asset in the organization once the individual is on board. The really intelligent players are either going to partner with a firm or bring the talent access function in-house and start to have the specialization in each of those verticals that are going to allow them to get access to the A players, whether it's an interim contract role or a full-time role. But currently, that is not the case in a majority of organizations. And again, overworked, under-resourced, and does not have the proper training and tools to attract in 2020, 2021 moving forward, the players that you need to attract rather than the ones who are just looking for a job. So look for that to be a very, very aggressive move by the forward-thinking organizations. Let's get into interim for a second, why it's valuable to organizations. Again, it's an on-demand hire, it's speed, flexibility, and capital efficiency. Those three characteristics are going to be the cornerstone for the next 12 to 18 months as companies come back online, get themselves out of a hole, look at their balance sheet, address their shareholders if publicly traded or if private and venture-backed. Those are the three areas that we're going to overlay on all talent decisions moving forward. So that's actually a positive. If you're out of work right now or you're underemployed right now, you need to play to those three items as you look in the marketplace. So that's the company side of structure. Let me sprint now into a strategy of if you're out of work, if you're underemployed, and if you're just simply networking, which you should be, and everybody should have this wake-up call over the last 3 months, you should be networking aggressively now when you don't need it, because when you need to network when you need it, it's way too late. This is probably the most powerful approach and the best tool I can give you when you're underemployed, unemployed, or just networking. It's called the 10-4-2 ratio. Go out over the next 30 days, and I want you to identify 20 companies that you want to work for, work with, or partner with. Get those 20 companies on LinkedIn. And then I want you to look at all the directors and above in that organization, and I want you to follow them or connect with them online. So they become part of your ecosystem, at least from a connection. Then what I want, and again, all functions, design, development, quality, reg, clin, whatever it is. Then what I want you to do is once you have those 20 companies and each of the directors and above, I want you, as regular as you show up for your exercise, as you eat your bagel in the morning, as you show up at whatever it is you do, you brush your teeth, I want you to set aside 30 minutes every day, and especially 30 minutes to 60 minutes on the weekend. And I want you to go and look at what each of those individuals have posted online. And in this ratio of 10, 4, and 2, on every 10, I want you to like whatever their posting is. Out of that 10, every 4, I want you to have an intelligent comment on their post. Once in a while, you can give the icon thumbs up, but an intelligent response without overcooking it at a ratio of 4 out of those 10. And then finally, out of those 2, I want you to share that individual's post, and I want you to put intelligent editorial that supports a point they're making or something that they're sharing. Here's what happens. I don't care if you've got 28,000 plus followers like I do, or 12,000 like Holly does, or 142. Once somebody likes a post you put up, what is the first thing that you do? First thing you do is go, who is this? And you go check out their profile. Now they do that repeatedly for you, respectfully, repeatedly. Suddenly you become part of their inner circle in their ecosystem on LinkedIn. I'd hazard to say that a majority of people are learning to respect their LinkedIn ecosystem and their inner circle of people who support what they post. You now have insinuated yourself into their personal and professional career life, and you've become part of their community tighter than you ever have before, and you haven't sent a resume in yet. Now, as you create your content and put out intelligent content eventually, they will see it as well, because that's the way the LinkedIn algorithm works. And they'll start to see that you're adding value, giving back to the community, which is what we do, which TMG doesn't ask. We always just give back to the community. And now that you give back to the community and you're not even looking for a job, but once you do pick up your head and you are looking for a job, you can then reach out directly to those connections on LinkedIn who have watched you give back to the community before you've asked for anything. And now that you're going to have an ask, in other words, maybe interview or send your resume to them, now that you're connected online, there's no HR in the middle of it. And now you've got a much warmer, or actually friend, in your corner as you go ahead and apply for a role, or at least lean in to see if they may know somebody who's networking. So that's your 10-4-2. And again, 10 likes, 4 comments, 2 shares. I always leave with this. Do not mistake the tool for the user. A basketball in the hands of LeBron have a different ROI than in Billy Bob. Same tool, different use. That's what I got for you today. Any questions?
Awesome. That's great. So everybody pop your questions into the chat bot. Brian, feel free to jump in. I know you likely have a lot of questions as well. I really think it's important what you mentioned about specifically the social media. I know as a younger person, I always tend to look at social media and say this is for cats, right? It's for weird videos, and it's not even a thing anymore. I'm really interested to hear your perspective, and we got a question previously about the difference on types of LinkedIn memberships. Do you need to have a sales membership? Do you need to have a premium membership? Do you need to do these things, or can everything you're saying to do just be done through a basic membership?
You can do that through a basic membership. I don't know all the products out of LinkedIn, but I know that strategy works, and I've been sharing it with the people that I do consulting with and coach. So it certainly does help and gives you a different look if you've got a recruiter license or some other license. But from the ongoing network and the access, at this point in time, it shouldn't make a difference at all in regards to how your feed appears, how the algorithm treats it. There is a difference on the back end on your search ability, though. But for the most part, everybody is accessible if you identify the company and look for the people who are in the company.
Okay, another question. What's your hiring outlook for med device in 2020, 2021?
Oh, I think it's as robust and promising as ever. Look, there are some companies that went out of business because of C-19, and I hazard to say, as a general statement, they were going to go out anyway. I think it just accelerated what was going to happen. I do believe, though, in the venture community, you're going to see less A-round investments because the investors, the VCs, are going to be keeping their dry powder for the later stage and choosing which 4 or 5 of their 10 entities in their fund they're going to keep alive. So you may see a little hesitation there. But on the flip side of that, in the startup world, I believe you're going to see new investment vehicles coming back online. I also believe that you're going to see tremendous investment on the digital side of the business from others that are going to be coming in from outside. I do forecast that within 5 years, Amazon or Apple, it could be Google, but primarily Amazon will be one of the top 3 healthcare medical device players in the industry. And as you know, Amazon has got a reasonably large footprint and growing up in the greater Boston area. And I also believe on the digital side of things, outside 510Ks and PMAs, you're going to start to see them leaning in aggressively from acquisitions of technologies in the workforce.
Great. Any thoughts on Walmart jumping into that? I just asked because I know they've been toying around with so many different opportunities for a really long time. Anything interesting there?
I think on the downstream side, you might see Walmart jumping into that. But when I come to companies like Amazon from a pure data play, pure data perspective, telehealth, the ability to deliver while you're sitting in your house on your iPad, and maybe you're 60 years old, maybe you're 15 years old, maybe you're 82. I can get my doc-to-doc teletherapy. I can immediately answer it right there on the tablet. It can appear to me the next day, either it's a DME, a durable medical equipment, or a pharmaceutical. And then the other side of that is, if you think about from the capability of actuarial data analysis, I can tell probably what your BMI is, what you order from me, how many rolls of toilet paper, are you regular, what exercise equipment. I mean, the information at hand that Amazon has in order to do everything from data analytics, predictive analytics on a device in the OR, ICU, CCU setting, and they are, AWS is the leading supplier of that cloud platform. I just see them being so insinuated. I do, and in the sort of outlets, whether it's a Walgreens or I don't know what it is regionally up there. I know there's a couple, but I see them walking into the full healthcare continuum from patient visit all the way through the continuum of care down to the delivery of the therapeutic. I do believe they will highly likely be in the same mouth as Medtronic and J&J in the same conversation in less than 5 years.
Interesting. Okay, so I have one come in that's a private question, so I'm going to summarize it for you. But someone's asking about how to address the issue of being seen as an in-between stage. So worked at a very high level for a few months, then was laid off. So companies now don't want to hire at that higher level because there's not enough experience. And then other companies don't think that they'll be happy at that lower level because they have worked. Mm-hmm. Any thoughts on kind of how to not downplay your resume, but understand your resume's strengths?
Yeah, so good question and very relevant. So look, ageism is going to come in. If you were 50 plus and you were furloughed, downsized, right size, or cut, you're going to have a bigger challenge than a 30-year-old. One is ageism is going to come in. Two is you probably had a higher salary. So coming back on board is going to be more expensive, especially from a perm full-time employee. That's why I'm recommending you really position yourself to come on in an interim basis. So you can either go W-2, you can go 1099, you can start your LLC. You need to position yourself at getting back on the field, solving problems in an interim basis. Because if you're only going to put your oar in the water and you're not going to relocate and you're only going to look for full-time employee and you're only going to go 10 or 15% plus or minus on your past salary, you're threading a needle there. And the longer you're out of the market, the more challenge you're going to have. So don't allow your own narrative in your head to limit what the market possibly may have in store for you. Because right now, that concern, while it may be valid, it may not be, but that's your fear getting in the way right now. What you need to do is say, why not me, and position yourself. And I'd be happy, Brian and Rachel, to come back on and give a longer session on how do I position myself specifically to re-enter the market if I'm falling in that 50 plus or less, and what are the methodologies I should use to get in front of as many people. But the first thing I would do is the 10-4-2, and then in the next 30 days, if Brian and Rachel can get me back on, you'll have some traction and you'll have some data to ask me more specific questions.
Take a look at your mute buttons, folks. Somebody is unmuted. Sorry, just a little background
noise. No
problem. Okay, so I'm going to give you one more quick question, and then I will let you go because we do have a lot of content. But can you comment, and this is obviously not a quick question, on how working may change in the next 1 to 2 years? There's more teleworking, more digital health. How do you see that transforming how employees work, and how does that influence the way they hire?
So it's a great question. It leads up to the previous one. Look, there are going to be organizations hiring that you should look at outside the greater Boston area because they're going to be open for telehealth. We've got a big contract going on right now. I can't tell you who it is. They're tied to the coronavirus. They're an in vitro diagnostic company. They're looking for 40 full-time QEs, quality engineers, to work from home in order to help get one of their product platforms over the line to address rapid testing. That would have never happened before. So as you look at opportunities for reemployment, look outside the greater Boston area because more and more organizations are going to accept and have to use a telecommute or a tele-engagement situation. So I see that happening. And on the other side of things, I think you're going to have a lot more flex time. So if you were only looking at a 1 hour commute, you may want to look at a 1.5 hour to 2 hour commute because you may only have to go into the office 2 days a week. And you could decide on your lifestyle if that's acceptable or not.
Joe, thank you. I think we were probably getting enough questions to keep you here for a whole hour, but I think having you back on in the next couple of weeks would be fantastic to talk about a lot of these things. I think there's a lot of interest and a tremendous amount of opportunity for people to try and take advantage of the situation and make something that wasn't necessarily pleasant as positive as possible. So I want to say thank you. Thank you so much for all of this information, and we really appreciate you joining us.
You got it. Be well, everybody. Best wishes.